Why are kidney cancer genetic guidelines unclear? Have you ever wondered why the genetic guidelines for kidney cancer seem so unclear? This question is important because understanding genetic factors can help with prevention and treatment. The complexity of kidney cancer genetics plays a big role in this uncertainty. Kidney cancer can arise from various hereditary syndromes, each linked to different genes. Some of these include von Hippel-Lindau disease, hereditary papillary renal carcinoma, and Birt-Hogg-Dubé syndrome. Each syndrome has its own unique features, making it hard to create a single set of guidelines for genetic testing and counseling. Another reason for the unclear guidelines is the variable clinical presentation of kidney cancer. Patients with hereditary kidney cancer may show different ages of onset and types of tumors. Some might have bilateral or multifocal tumors, while others may not show clear symptoms early on. This variability complicates the decision on who should be referred for genetic testing. The methods used for genetic testing are also evolving. Currently, many tests focus on targeted gene panels that look for known kidney cancer-related genes. However, these panels might miss rare or new genetic variants, especially in non-coding regions of DNA. Newer methods like whole genome sequencing and RNA testing are emerging, but they are not yet standard practice. This ongoing evolution adds to the uncertainty surrounding genetic guidelines. Another challenge is the presence of variants of unknown significance. Genetic tests often find variants, but their impact on cancer risk may not be clear. Understanding these variants requires more research, which can delay the development of clear guidelines. Additionally, there is a lack of large-scale, high-quality evidence regarding hereditary kidney cancer. Most existing data comes from small studies or retrospective analyses. This makes it difficult to create universally accepted guidelines based on solid evidence. Guidelines must also consider the balance between the benefits of identifying hereditary risks and the costs involved. This includes potential anxiety for patients and the implications for their family members. Different healthcare systems and populations may approach this balance differently, leading to variability in guidelines. Professional organizations regularly update guidelines as new information becomes available. However, there is still no complete consensus on who should be referred for genetic counseling or which testing panels to use. Generally, referral is recommended for patients with early onset, a family history of kidney cancer, bilateral or multifocal tumors, or suspicious histology. Yet, these criteria are not applied uniformly across the board. In the context of kidney health and cancer, these factors mean that genetic guidelines are still being refined. Clinicians often relying on a mix of clinical judgment, family history, and existing guidelines to determine the need for genetic evaluation. Patients who suspect they may have hereditary kidney cancer should consult genetic specialists for personalized assessments. Ultimately, the unclear nature of kidney cancer genetic guidelines highlights the complexity of hereditary kidney cancer biology, the limitations of current testing methods, and the need for ongoing research. This emphasizes the importance of personalized medical advice and genetic counseling in managing kidney cancer risk.